I'm Executive Director Kevin Robertson, and this is the KDA Video Minute for Monday, January 14th. Well, today's a very important day because it is the first day of the 2013-2014 legislative session. So we've got about 55 new legislators that are in Topeka today being sworn in to try to start what will be a 90-plus day session. And a lot of issues, taxes, appropriations, of course, dental issues that we all know about that we'll all be discussing. So it's a big day. Today, traditionally, is the day that the Kansas Dental Association delivers toothbrushing kits to each one of those legislators, and we'll be doing that later today. And try to introduce ourselves and so people know who we are and where, and it helps me in order to find out where everybody's new office space is. So it's a good day, kind of getting started with the session. This year, the leaders of the House and Senate, of course, have changed after the elections. So the Senate is the new president is Senator Susan Wagle. The new majority leader is Terry Bruce, and our new Senate committee chair for public health and welfare is Mary Pilcher Cook. On the House side, Ray Merrick is the Speaker of the House. Gene Vickery is the majority leader, and the chair of the House Committee on Health and Human Services is David Crum, who's an optometrist down in Augusta. Last week, leading up to the legislative session, the KDA with the local district dental societies of Topeka, Wichita, and 5th District Dental Society hosted meet and greets in those three communities and had a very nice turnout at each one of those. We had dentists and legislators, of course, come. We talked about legislative issues. It was a good opportunity just to talk about things with the session and where we were with oral health issues. And I want to thank all those dentists that attended those meetings or those meet and greets. Generally, they were from 5 to 7. 5th District, we went 5 to 8, but had a very nice turnout, and I really do appreciate the time and effort the dentists took to make those successful. Legislatively, last year, the Kansas Dental Association passed a comprehensive oral health initiative, and it had several different provisions in that, including the ECP3 hygienists, which extended upon the existing public health ECP 1 and 2 hygienists, allowed them to do more activities in nursing homes, schools, prisons, and better treat that population of underserved people. Federally qualified health centers, one of the places they can work, community health centers, local health departments, things like that. Places that treat underserved persons and people that are Medicaid eligible and are lower income. We also passed a charitable healthcare provider exemption for dentists that do charity care, organized charity care, or organized charity program in their dental office. So example, if you're signing up for Give Kids a Smile, or you're doing like an office mom project, working with your local community or your local community social service agency or something like that, you can do that work in your office, and that is you'd be exempt from liability for that particular activity. Also, we passed a new license for retired dentists, a retirement status license that allows a dentist to maintain his licensure, no fee, without having to do the CE courses and things like that, as long as they're doing charitable work. So you can maintain your license, you can still come to KMOM and help out, you can still help out in your local health department, federally qualified health center, whatever your favorite charitable type organization is, and as long as you're not being paid, if it's certainly a gratis thing that you're doing, then you can maintain your license and then not have to pay those fees. So we try to do some things to try to create more care that way. At the board meeting coming up later this week, at the Kansas Dental Board meeting later this week, UMKC will get approval for its ECP3 training program, and we'll begin working with them in order to get those ECP3 hygienists trained and out there. We really need dentists to be involved in these programs, to be sponsors of an ECP 1, 2, and 3 hygienist so that they can provide more care in these different settings and to help show that model is successful and to make that model successful as we move forward to provide care to some of those people. So look forward to working with you. Contact the office if you need to have more information or would like to know more about that. But those things are all important that we stay involved in and be active in. Also, back in 2009, we worked to carve out the 50% rule for satellite practices to allow a satellite practice to be in a county of less than 10,000 without you physically having to be there present. So you could hire an associate, set them up in a practice of less than 10,000, and then you not be there. And we would really encourage some dentists, particularly in rural areas, if you're out in a place where you're surrounded by counties that are smaller, to kind of think about that and how you might be able to expand your practice and access into some of those more rural areas. So again, there's things we'd be really interested in and want to help you work on if you're willing to do that. And please be involved again with all these issues, and stay tuned with the workforce issues that are going on with the legislature and elsewhere. We do know that the Kansas Action for Children, the Kellogg Foundation folks, the Kansas Association of Medically Underserved, and what they call the Kansas Dental Project will be working to pass a registered dental practitioner mid-level. We don't know what that bill looks like right now. We assume it's probably been amended and changed from what we saw before, but that's something that we do have some great concerns about with the level of care that would be provided and the supervision that a dentist would provide these people to go along with their training. So we encourage you to talk to your legislature about these issues, about the things that the Kansas Dental Association is doing, and to make those people aware that really, as we've been saying all along, that all Kansans deserve a real dentist. With the legislative session ramping up, I want to remind everyone that Dental Day will be on Thursday, February 7th here in Topeka. We'll start down at the Dillon House like we have traditionally. We'll kick things off about 8:30. We'll head over to the Capitol. We do have a press conference that we're working on, and of course we'll meet legislators and talk about our issues. We don't know if we'll have a specific committee hearing at this point in time that we'll be involved in. That all kind of comes together later on as issues come up, and whether or not we have the opportunity to work something out with the committee chair people. But that's kind of the game plan. We hope you can all make it. Apologize, the KDA office has been hit by viruses, both of the computer and the human type, the last couple of weeks, so we've had some issues getting some things out. But Dental Day is certainly on for Thursday, February 7th. You have not received a brochure about that yet, but we'll get those out to you as soon as we can. We'll make those available online and send you an email notification on that so you can all get signed up and prepare to be here. I think it's very exciting here in the last couple of weeks. At the end of last year, our KIND Advisory Committee met in late December and did select 3 scholarships for our KIND Scholarship, and also approved a $50,000 loan forgiveness award for next year. So we have, with our work with Delta Dental of Kansas Foundation, we'll be awarding and announcing on Dental Day, as part of that press conference that we talked about earlier, to 3 $25,000 scholarships to three different students that are looking to go into more rural areas of the state of Kansas, including one that's going to go to far western Kansas, and then a loan forgiveness grant for an existing dentist who will be moving his practice to an underserved area. So we're very excited about that, and stay tuned for that announcement on who those people are and where they're going to be as we get closer to Dental Day. Of course, I want to remind all the delegates that on Friday, January 25th, the Board of Delegates will be meeting in Emporia at 1:30 at the Emporia Country Club. Look forward to having all of you there and attending. Now, it's not a special board meeting, but it comes at a different time than meetings in the past, because we're changing some of the things we're doing with the Chicago trip that we have planned. We had to move a board meeting in order to make all that fit into the schedule for the year, meet our bylaw commitment. So January 25th in Emporia, we will be having a board meeting, and we look forward to everyone being there. That's certainly a delegate. And let me finish up by reminding everyone that KMOM planning is well into fruition here. We're about 6 weeks away from KMOM Wichita, which will be at the Pavilion 2 at the side of the old Kansas Coliseum. That's exactly where we were back in 2005 when we were in Wichita at KMOM. And so if you remember that and attended, you kind of have an idea where we'll be. Later this week, we should have enrollment and registration open for that. The plan is we'll send you out an e-news announcement with the link to the registration. So you don't have to check our website every day or every minute of the day. We'll get you that e-news. Look for that email with that e-news with that link, so you can just go right into that and get that done. And look for that here later this week. So thank you very much for your time today, and we look forward to working with you throughout the legislative session.